The evolution of public health. A comprehensive overview. Public health is a dynamic and multidisciplinary field that encompasses the health of populations and the collective societal efforts undertaken to protect, promote, and restore that health. It extends beyond individual care to include the prevention of disease, the prolongation of life, and the promotion of health through organized community efforts. Central to public health is epidemiology, the scientific study of patterns, causes, and effects of health and disease conditions in defined populations. Epidemiology is often referred to as the basic science of public health because of its focus on identifying risk factors and designing effective interventions for disease prevention and control. Unlike clinical medicine, which treats individuals, public health treats the community as the patient, with a primary focus on prevention rather than cure. This approach relies heavily on data collection, analysis, and evidence-based decision-making to improve health outcomes at the population level. Historical foundations and early thinkers. The origins of public health can be traced to ancient civilizations that recognize the link between environmental conditions and health outcomes. Concerns about clean water, food safety, and proper sanitation were integral even in early societies. Over time, explanations of disease shifted from supernatural beliefs to scientific inquiry grounded in observation and analysis. Key contributors and milestones include Hippocrates, often considered the father of medicine and possibly the first epidemiologist. Hippocrates rejected supernatural explanations for disease and emphasized environmental and behavioral factors. He introduced the concepts of epidemic and endemic and observed that different illnesses occurred in different geographic and seasonal contexts, laying the foundation for environmental health perspectives in public health. Thomas Sydenham advocated for empirical observation in the classification and treatment of diseases. He emphasized the use of non-pharmaceutical remedies such as clean air, exercise, and diet, illustrating an early understanding of the social determinants of health. John Grunt, regarded as a pioneer in vital statistics, Grunt analyzed the bills of mortality in 17th-century London. His 1662 publication tabulated deaths by age, sex, cause, and season, establishing the value of systematic record-keeping and demographic analysis in understanding public health trends. William Farr, building on Grunt's work, Farr developed the modern system of vital statistics. As the chief statistician for the Registrar General's office in Britain, he demonstrated how mortality varied by occupation, geographic location, and socioeconomic status. Farr's data-driven insights into the links between environmental conditions and health outcomes influenced major public health legislation, including the sanitary movement. Edwin Chadwick, as social reformer and advocate for sanitary reforms, Chadwick's landmark 1842 report, The Sanitary Conditions of the Laboring Population, provided compelling evidence of how poor housing, contaminated water, and overcrowded urban living contributed to disease and death. His work led to the Public Health Act of 1848 and the development of municipal sanitation infrastructure. The birth of epidemiology and the germ theory of disease. John Snow, widely recognized as the father of modern epidemiology, Snow investigated the 1854 cholera outbreak in London. He hypothesized that the disease was waterborne and used mapping and a comparison group to link the outbreak to a contaminated public water pump on Broad Street. Though germ theory was not yet established, his use of empirical data and spatial analysis to investigate a public health problem marked a turning point in epidemiologic practice. Louis Pasteur and Robert Koch, these two microbiologists, were instrumental in establishing the germ theory of disease. Pasteur's experiments demonstrated that microorganisms cause fermentation and disease, and he developed vaccines for diseases like anthrax and rabies. Koch provided further validation by isolating the causative agents of tuberculosis and cholera and formulating Koch's postulates, which are still foundational in infectious disease research. Ignaz Semmelweis demonstrated the importance of hand hygiene in preventing puerperal fever in maternity wards. His insistence on antiseptic practices significantly reduced mortality, though his findings were not widely accepted until after his death. Florence Nightingale, a pioneer in nursing and hospital reform, Nightingale used statistical graphics to demonstrate the impact of unsanitary conditions during the Crimean War. Her focus on cleanliness, ventilation, and nutrition laid the groundwork for environmental health in medical institutions. Expansion of public health infrastructure. Lemuel Shattuck. In 1850, Shattuck published the report of the Sanitary Commission of Massachusetts, which emphasized the need for state and local boards of health, systematic data collection, school health programs, and sanitation infrastructure in the United States. His proposals anticipated modern public health systems and epidemiological surveillance. Alice Hamilton. A physician and researcher, Hamilton was a pioneer in industrial toxicology. She investigated occupational hazards such as lead poisoning and worked to improve conditions for American laborers, significantly influencing workplace health regulations. Wade Hampton Frost, often called the father of modern epidemiology in the U.S., Frost was the first professor of epidemiology at Johns Hopkins University. He conducted influential studies on polio, tuberculosis, and influenza, and helped establish epidemiology as a rigorous academic discipline integrated with biological and clinical sciences. Shifting public health priorities. From infectious to chronic diseases. By the mid-20th century, infectious diseases in industrialized countries were increasingly controlled through vaccination, sanitation, and antibiotics. This success revealed a new set of challenges. Chronic diseases such as heart disease, cancer, and diabetes emerged as leading causes of death. These conditions often developed over time and were influenced by complex interactions of behavior, genetics, and environment. This epidemiological transition required the development of new research methods. Landmark studies such as the Framingham Heart Study revolutionized our understanding of cardiovascular risk factors, such as hypertension, cholesterol, smoking, and physical inactivity. The shift emphasized multifactorial etiology, the concept that multiple interacting risk factors contribute to disease onset. Modern public health systems, science, and social determinants in response to mounting health threats, including the HIV/AIDS epidemic, rising chronic disease rates, and environmental degradation. The Institute of Medicine published its seminal 1988 report, The Future of Public Health. This report defined the core functions of public health as 1. Assessment, systematic collection and analysis of health data. 2. Policy development using data to formulate public health policies. 3. Assurance, ensuring that necessary health services are provided to populations. These functions mirror the diagnostic process in medicine and are supported by disciplines such as epidemiology, biostatistics, health policy, and environmental health science. The report also prompted a revitalization of public health infrastructure and initiatives such as the Healthy People Objectives, a set of 10-year national goals for improving the health of Americans through evidence-based strategies. Today, public health continues to evolve, responding to global pandemics, health disparities, mental health crises, climate change, and the impacts of social determinants such as income, education, housing, and systemic racism. The field draws from behavioral science, economics, informatics, and environmental science to address contemporary challenges and promote health equity. Conclusion: the history of public health reflects humanity's ongoing struggle to understand, prevent, and respond to disease. From ancient sanitation systems to modern epidemiologic surveillance, the field has consistently adapted to emerging health challenges and scientific advances. Groundbreaking thinkers, Hippocrates, Snow, Nightingale, Koch, Shattuck, Hamilton, and many others, have shaped a field that now spans disease prevention, health promotion, and policy development. As chronic diseases and global health crises dominate the 21st century, public health remains rooted in its founding mission to improve population health through prevention, education, and systemic action. Its future depends on continued innovation, interdisciplinary collaboration, and unwavering commitment to the well-being of all communities.